Hello everyone, and welcome to Your Health, Your Choice. I am Dr. Roopnarine, and we are coming to you live from our studios at ACTN. On tonight's program, we'll be discussing the COVID-19 pandemic and the next steps forward. With me in studio tonight to share his own personal insights and opinion is Dr. Aroon Narayansingh. Dr. Narayansingh is the Medical Director at the Medical Associates Hospital in St. Joseph. As usual tonight, our number should come up at the bottom of your screens, and we will do our very best to get to your questions and your comments in the final segment of the program. So guys, welcome back. We had a little absence last week. This is a live program, and let's get the show going, and let's say hello to Dr. Aroon Narayansingh. Hi Doc, how are you going? Nice to see you in the studio. Thanks for coming in. I know it was a long drive down.
Well, Robin, thanks for having me.
You're very welcome. You're very welcome.
And I'll be glad if I could help the
Thank
public
you.
in any way in understanding what the pandemic is about.
Thanks, Doc. So, Doc, one of the best ways I was thinking of delivering the content of this show to kind of guide people with the way forward in the pandemic is to kind of sort of have a look at all the recent mainstream media clips and sort of address it so that we give people some clarity from your medical opinion. All right? So, Josh, if you could just start us off with the first slide, the first clip. Right. So now, this is the main headline of the Sunday Express newspaper this week. Vaccine milestone. 50% of our population fully inoculated against COVID-19. So, Josh, you could take it down there. So, Doc, my main question to you is, I mean, at this point in time, we're in February, we're in 50% of the way there. It's a milestone. Is the cup half full or is the cup half empty? You know? In my own personal opinion, I would have thought, and the goal would have been to have a lot more people vaccinated at this point in time. So my question to you really is, why is it important? The vaccination program has more or less stalled for a while now, and it's proceeding at a stall rate. What needs to be done to revitalize the vaccination program to get more people vaccinated? What strategies need to be changed? Because in my opinion, I think some innovation is needed. We're moving along and it's not happening. And so what strategies would you suggest that could be done to revitalize the vaccination program? And why is it important for our patients at home to go out there and get the vaccine if they haven't gotten the vaccine as yet?
Well, Robin, the vaccination program might have stalled.
Yeah.
And there is a need to get it going.
Yeah.
But you mentioned 50% full and 50% empty.
Yeah.
No, that's 50% is 50% counted.
Yes.
We haven't in that, my belief is we haven't in that counted the people who have antibodies.
Correct. Correct.
So if we count who have antibodies, we'll go way past the 50%.
Correct. However, that in terms of our vaccination program, you could only really count the people that you have vaccinated.
Yes.
And,
yes.
and my point being is that the actual vaccination program,
yes,
we could never judge in a wide-scale population how much people have antibodies so easily. But in a wide-scale program, we only have 50%. The CMO is looking for about 90%.
Right. But now, there are a lot of Ministry of Health drives, I see ads going out to try and get people vaccinated.
Right.
On the other hand, you have people who saying don't get vaccinated.
Correct.
Right?
Correct.
So this is where I think it's confusing to the public.
Okay.
But we are much more protected than I think we are.
I understand.
And we should make change. Now, the pandemic is a evolving thing, right? It's not static. It's evolving. And as it evolves, our protocols have to evolve.
I agree. I agree. But I really just want to pull you back to the actual vaccination itself, the program. Mm-hmm. Do you see it as necessary that they need to increase, the new strategies need to be done?
Yes.
Okay.
Yes. And one of the things I would like to see is vaccinating of children between the age of 5 and 11.
Exactly. You have to push for that.
I would like to see that, because when children 5 to 11 start going to school, we all know what has happened to children and families, how the flu and the virus spread. A big part of it is in school. So if we could get these children vaccinated before they go to school, then it will make it easier on the health system.
I understand. So you're saying the cup is half full? You're optimist?
I think it's a little more than half full.
Okay. So when I was thinking about this question right up, and I was thinking, well, all right, so the goal of a vaccination program in Trinidad would have been to at least get 90% of people counted vaccinated at the start, right? This is not people who would have been contracted the illness. And I said to myself that if you're running a program at this point in time, when you're not getting more than 50% vaccinated, that's something else needs to be done. And one of the things that I came up in my own thoughts was, I think it's time that they allowed the wider general doctors like myself to vaccinate the patients. I think that might increase the number of people that will get vaccination. I don't know if you would agree or not.
Well, anyhow you could do it. That's fine.
Yeah.
The thing is, at some time vaccinations were sharing all over, you know.
Yeah. And it slowed down. Yeah.
But even it slowed down, and then it makes no sense if it's slowed down. You keep the same amount of things at distribution centers running.
Exactly, the mass vaccination
sites.
Right.
So you cut back according to the needs.
And you move it up more to the community.
Yeah. Yes, and they send it out to various hospitals and so on as well. And exactly. I'm not sure if it went out to any GPs.
And I think more education is needed to the public.
More education is needed, but how? I see a lot of efforts on the TV to try and get people to be vaccinated.
Right. How you deliver a message is very important, right? So in my opinion, I think engaging more of the community, probably going around a lot more to the homes, probably engaging more community channels like ourselves, probably having in the rural areas village elders calling meetings, people of respect in the neighborhood talking to the other persons, more local sports athletes, bringing on the message, answering questions is very important, because it's not only about giving out a message that vaccination is important, it's about answering the questions or the hesitancy questions as well that will bring it about. I have a big question for you, Doc. Why is it important at this stage that people go out and get vaccinated still? Because there are a lot of people who are not vaccinated. Why do you think they need to go out and get vaccinated?
Because that is what will protect the health of the country.
Yeah.
That is what would protect the health of every elder who is at risk.
Exactly.
So you need to protect these people, and by vaccinating the population, you would have the comfort of...
All right. So you would have a lot of people out there who would say, look, Robin, it's been 2 years now, and I haven't gotten sick, and I didn't take the vaccine. What would you say to those people?
They haven't gotten sick.
As far as they know.
Right.
And they haven't gotten the vaccine, and they're worried about the vaccine. A lot of people are actually more scared of the vaccine than the actual coronavirus.
But now it's difficult. There's some people that it's difficult to get through to. And
yes.
And they would honestly believe that there's some protection for them. Right? And maybe who's the judge, right?
Mm-hmm.
But
exactly.
And that is what their belief is. The only time they will lose that belief is when something happens. And even then, they may still not believe that the vaccine would be helping them.
Yeah.
So that's a difficult thing.
Yeah.
It's difficult to change the way people think unless you could show them in some tangible way that is
all right, but you're a man that could probably give them a tangible way, because you work in the ICU in anesthetics.
Yeah, but they don't see that.
In your hospital, for example, right? In the ICU department during the COVID time, what, if you have a rough idea, what percentage of the patients who are unvaccinated who are in the ICU department itself? If you have those figures offhand.
I don't have it offhand, but I could give you a rough estimate.
Yes, please.
And it would be 85 to 90%.
Who are unvaccinated?
Unvaccinated.
That end up in the ICU.
Yeah.
All right. So,
but that's a small hospital.
It's a small hospital.
You can't use that.
Probably, you can't use that as anything. But it's just a personal recount of recourse. All right. All right. So So it is important for people to continue getting the vaccination. You're saying that it is very hard to get the message out at this point in time.
Yes.
Maybe some changes need to be made in terms of the mass distribution centers for vaccinations to try and increase the vaccination rates. Is that what you're saying?
Yeah, but how do you do that? That's what the question is. How do you get more people to come to be vaccinated?
Which is, yeah, exactly.
When they already make up their mind.
Yeah.
The vaccine is there for people to use it quite some time now.
Yeah.
And if they're not using it, I feel it will be difficult to, unless they see what's happening in the hospital.
Yeah.
That is the only thing that might change their mind.
Take the cameras into the hospital.
That is one thing.
Take the TV cameras into the hospital.
Yeah. And let them see these people on ventilators, or let them see people not on the ventilators fighting for breath.
Interview the patients.
Interview patients. The patients can't talk very well when they can't breathe.
Exactly. All right, Josh, let's get the next slide up there. Right, so Doc, this is you'll certainly recognize this article. That's you there.
Yes,
and a report from the, I think that was the Trinidad
yes.
Guardian, was it? Or Express as well.
Yes.
So the headline there being time to return to normal. Doctor claims Trinidad and Tobago approaching herd immunity. Doc, why do you think we're approaching herd immunity? Why do you think it's time to return to normal?
Because my belief is if you add the vaccination to the people who have the aim of the vaccination is to produce an antibody.
Correct.
The other way you get antibody is by getting ill.
Correct.
By getting the virus. Correct. And by getting the symptoms and
right.
when you another form of protection. Antibody creation.
Correct.
Just like the virus.
Correct.
So if you add them up, I feel you would be 70+% in the population.
Yeah.
70+% put you towards herd immunity.
Yeah. No.
And if you have that amount, now the other thing is if you look at the hospital, the hospital is way under.
Exactly. Yeah.
The
levels have fallen off.
Is way under what it could be, right?
Correct. So
it
has
fallen from high to kind of low now.
Right.
The deaths, the patients per day and the deaths are not as high. That ratio is not as high in deaths as it was.
In December, for example.
Yes.
Exactly.
So the things are getting better.
Right. So based on that, you'd assume that you're coming closer to immunity.
You have to now start to open up.
Yeah.
To let the country go forward.
I agree.
Right? Let people start to live. More people will get the virus.
Yes.
Less people will get as ill.
Yes.
It wouldn't be overloading the system.
Yeah.
And when all this happens, more people will get antibodies.
Yeah. Yeah.
And then we'll be in a comfortable position.
Yeah. To move forward.
Yes.
All right. Just a little comment on my side from what you're saying there, right? Vaccination is very important regardless. And I think the reason being this, the vaccination will give you antibodies, and we're assuming that given our previous history of vaccines and vaccine creation, that you'll get some T-cell immunity, which will be long-lasting immunity, perhaps lifelong immunity.
Yeah.
Coronavirus is not going to go anywhere. Right, it's going to be endemic. We have only really eradicated polio in the last. It's how
the population could deal with it.
Exactly. So the vaccination will protect the population in the long term, and as well, not just during the endemic.
Yeah.
And a very important part of that as well is, people could become re-vaccinated with coronavirus. They could become re-vaccinated with COVID.
Of course.
So the protection with the vaccine plus the active infection will give them sufficient amount of protection to prevent them from getting ill and dramatically ill if they're infected again.
Yes.
The other thing that I was thinking about as well is that the vaccination rates would have dropped off because I think people might have thought that once they've gotten sick, that the immunity from getting sick would carry them forward long term.
Yes.
And that is not really proven with coronavirus. And I think that's one of the major
They should be
considerations.
vaccinated. There's a period of time, 3 months or whatever after, you take your vaccination just like before, so that you will maintain your antibody levels.
And another very important part of being vaccinated is the major problem with COVID, to me personally, and I see it with my patients, is the risk of long COVID, right? LONG. And I think vaccination reduces that risk of you developing long COVID.
Yeah, because people suffer for a long time. They get better, but they don't get better as they were before.
Right. So let me ask you something, Doc. Are you saying the pandemic is over? Directly. Is the pandemic over, Dr. Narayansingh?
No.
Okay. Where are we now?
It's not over.
Right.
But we should be going back to a more normal life.
Okay. Are we at endemic stage yet? You're saying a large quantity of us are protected?
I believe more than 50%.
Okay. So when you say a more normal life, what do you mean by that?
I mean, people go back to school. Well, they open the beaches, they open the bars, they open restaurants. Now I see they're allowing children to go to restaurants, right? And all of that is good.
Yeah.
But the next step is to vaccinate children.
Yeah. And I think we need to go back mentally to normal as well.
Yeah.
It's a hard step for some of our population or world that's been under.
But once you start getting out there again and feeling comfortable, now you might go out there, but you're not feeling comfortable, right?
Yeah.
And you're looking over your shoulder.
Yeah. Are you telling people, look, be more comfortable in yourself. Be safe to go.
You have to be confident in yourself.
You have to be confident.
Yes.
You're not going to get sick if you're vaccinated, and at this point in time, the risk is lower.
I am protected.
Yeah. Tell me.
But I go and I do my golf and my tennis and so on, and I don't let no virus stop me. Right?
Good.
Because that's a part of my life. And
you're not scared of contracting?
No, because I'm vaccinated, so I'm not scared.
Yeah.
So it's a mental health for me that I'm vaccinated.
Yeah. I think that's a very important point. Right, so we're going to take a little break now, Doc. And when we come back, we're going to discuss this idea of moving back to normal a little bit more when we come back. All right, guys, so we're going to take a little 2-minute break, and we're going to allow Dr. Narayansingh to collect his thoughts, and we'll be back in 1 minute. Thanks.
ACTN The Voice welcomes you to join us for our newest agricultural television series, Harvest.
Welcome to Harvest. We're doing it double again, north and south. This morning we start here in Brazil Village on Bethany Estate with Michael and Jacinta Mill.
You can look forward to a personalized tour around scenic Trinidad and Tobago, showcasing different agricultural practices and teaching us self-sustenance.
So Wendy, you're about to show me your bromeliad house.
Yes.
Oh, this is lovely.
This is what our customers refer to as the Mecca for bromeliads.
Explore the many ways to make your harvest right for you.
So our chicken coop is more or less built at a height whereby it's easy for us to go and just remove the wood shavings into our barrow.
Now, you don't plant out your seedlings, you buy the seedlings, right?
Yes, we purchase our seedlings.
Here we are on a not quite monocrop site, but we have rows of tomatoes, rows of sweet peppers, and then you have the Milnes polyculturing.
Join us every Tuesday at 6:30 p.m. Harvest, a new dimension in agriculture.
Controlling diabetes can be challenging, but at Caribbean Dreams, we have it down to a T. Caribbean Dreams Cinnamon Mint with Stevia. Cinnamon increases the body's ability to regulate blood sugar by increasing glucose metabolism. Peppermint adds that pepper flavor, while with Stevia all-natural sweetener, there's 0 calories and 0 carbs. Help keep your diabetes under control. Drink Caribbean Dreams Cinnamon Mint with Stevia. Caribbean Dreams, never stop dreaming.
All right, guys, welcome back. We're here with Dr. Aroon Narayansingh, and we're hammering out COVID-19 pandemic, the next steps, a return to normal. All right. So now, just prior to going on break, there was one big question. Like earlier in the year, you put out an article in the newspaper that you thought that people should be mandatory vaccines was a thing that needed to be done.
Yes.
And in that article that we just saw there, it changed your mind.
Yeah.
Why at the time did you think that mandatory vaccines were needed, and why you change your mind now?
mandatory vaccination at that time, right?
Which was when again?
Which was early on in the pandemic, when vaccines were available.
Yeah.
And we were moving slow at that time.
Yeah.
Vaccines were available.
Yeah.
I thought it was important for the public to be rapidly vaccinated to reach herd immunity as soon as possible, so that we could, as soon as possible, open up a normal life and have a normal economy.
Okay.
Right? Now we are halfway there. Right?
Exactly halfway there.
Halfway plus.
Yeah, plus,
right?
yeah.
And vaccination has stagnated.
Correct.
I think the way to get at least some more people vaccinated is in the school.
Okay.
I mean, it's done in the UK, going to the 5 to 11 now, the US in there a long time.
Yeah.
And that is one way of getting more people vaccinated, because the children are carriers.
Yeah.
They don't get as sick as the adults, but they are carriers.
Yeah.
Right? They will have, and they will be playing like normal.
Yeah. I suppose it's easier to vaccinate school populations as well.
Yeah. The problem is the parents control the children.
Correct. Correct. So there is a kind of roundabout coerced vaccine mandate on public servants, right? Where if they don't get vaccinated, they might not be able to get their salary, or so furloughed is the word. Would you agree with that? Or
my take on that?
What's your take on that? I want to hear your take on it.
My take on that is everything go to normal.
Everything go to normal. Leave them alone.
You're vaccinated, you go to work. You're not vaccinated, you go to work.
Yeah.
Right?
Yeah.
You're vaccinated, you go to school to teach. You're not vaccinated, you go to school to teach.
Yeah.
You're vaccinated, child, go to school. You're not vaccinated, child, go to school.
Yeah. All right, so let's full open back up then. All right. Josh, you can put back up the next slide, please. Right, so that's beaches, rivers fully open from Monday. And the next one after that? Unvaccinated children 12 and under allowed in safe zones. So, Doc, that's based on those two pictures, right? Was it ever unsafe to go to the beach?
I don't think so.
Yeah. What was the rationale?
The only way that it's unsafe is if you have beach parties.
Yeah, which you can't really have any kind of social gathering either.
Which is outlawed.
Outlawed, yeah.
But otherwise, to go to the beach and enjoy the sun and sea and the wind, that's a nice thing.
Yeah, and it has health benefits to go into the sea as well and swimming as well.
Yeah.
Mental health benefits. Nature is relaxing, it's antidepressant.
A lot of benefits by going to the beach.
Yeah.
The problem is you open yourself to the abuse of the system.
What do you mean by that? People partying, you mean?
Yes.
Yeah.
Then you'll have to have police on the beach all the time.
Yeah.
Because they will drink alcohol, music will play, and then they forget about distancing and mask wearing.
Yeah, but that raises another debate. Should you lock down masses of people, our entire society, in order to treat for the odd person who breaks the rules?
Right. That's a good question, and I don't want to answer that question.
And in my opinion, you should never compromise the rights and freedoms of the citizen who might be a good citizen in order to facilitate the one-off chance of somebody who does bad. Because remember, this is not somebody going out with a gun and killing people. Yeah. This is a virus we're controlling. And we're saying that maybe somebody might have a party on the beach that we can't control and we lock it down. No.
I agree with what you're saying.
Not in my point of view. The rights and benefits of the citizen outweigh that. It is your responsibility as an administration or as a police service to go after the bad people. This is not a man running around the beach with a machine gun shooting people. This is a party of people gathering. It's easy to control in terms of policing. So that's an administrative effort that is needed, in my opinion. And I think you probably agree with me now.
No, I agree with you.
Right. The key part now is, are safe zones still necessary in February 2022? What do you think?
I think the whole country should be a safe zone.
Yeah, it's not necessary anymore, is it?
No.
It's not necessary. Because a safe zone is an area where, and I mean, people at home might be shocked to hear you say this, why the doctors saying that, right? Because we're the ones who are supposed to be the most cautious and the most protective. But a safe zone is an area where only vaccinated people go to.
Yeah.
Right? And then I think it was Paul.
If we look at it, right?
Yeah.
You have a country with a population that is half vaccinated, half not vaccinated.
Yeah.
And it is not growing.
No.
Right?
Yeah.
And chances of it growing is very slim.
Yeah, practical man, yes, correct.
Right?
Yeah.
So
we have to try though.
Right.
Yeah.
You would be trying, but it ain't going. It ain't really going, right?
Okay, go ahead.
So what do you do?
You can't stay in lockdown forever.
All the good vaccinated people should not. You know, you go back to the same thing with the bad ones and the good ones. So the whole country will be suffering because of this.
Let's just move forward.
Yes.
And I think you're saying that. You're saying let's move forward in light of the fact that we are currently with a variant which is very mild.
That's true, but we have to look too at other countries in the world.
Yeah.
And if we look at the Americas and the UKs and so on.
Yeah.
Now in the UK it's like nothing. You could take a flight and go.
Yeah. And people do. I think I don't even think you have to wear masks in some parts of the United Kingdom.
You don't have to do anything.
Yeah.
And in certain parts of the States it's the same thing.
Yeah. And I think
I went to Orlando. Nobody wearing nothing.
You went to okay.
Packed tight.
Because the major reason why there have been such a relaxation of the rules is two things in those countries. One, obviously, they have had, well, most of them, probably apart from America, have had high vaccination rates. Mm-hmm. And the second part is people are really looking at Omicron as a mild variant that is spreading and giving people antibodies quickly.
Well,
the death rate from Omicron is less than 0.03.
What we have here now is Omicron.
I assume what we have here is Omicron.
It is reflecting in the amount of cases we have per day and the amount of deaths per day, which is in single figures.
Correct. There would have never been a drop-off in the amount of deaths like that in a hospital system that hasn't really improved magnificently so quickly, unless the variant changed and the variant was a milder variant.
Or the people changed.
I don't think the people changed. I think it was the variant.
Vaccinated and all that type of thing.
I think it's a milder variant. I think the virus has evolved.
Yeah, but vaccinated people also get sick and register as a positive.
Correct. But there was still a decrease in the amount of deaths and the vaccination program stalled since before December.
So half of your population getting the virus, but not getting sick, so they can't die.
Exactly. And the other part of it is, unlike other countries, like, for example, America and other places where we saw huge numbers of hospital admissions with Omicron, which is a milder virus.
And they're mildly sick, yeah.
In Trinidad, that's not our culture, really. People are not going to present to the main general hospital, in my opinion, from my experience as a general practitioner in the community, unless they really have to be in the hospital, you know what I mean?
No, the count.
People in Trinidad are not going to go into the hospital with milder virus.
People who got sick, not even tested.
Exactly. So yes, Doc, I would agree with you. I think we have hit herd immunity based on what we are really highly suspicious. We don't have the data like the ministry or anything like that.
Right.
But we are as clinicians watching outward, and we are seeing signs that this country is close to, if not about to hit herd immunity. And we are seeing signs that a lot of the regulations need to be relaxed. And we are seeing signs that we need to embrace the unvaccinated brothers and sisters out there as well as part of our general population moving forward. Not that we agree with not vaccinated. We want you vaccinated. We want you to try your best to vaccinate. But we cannot leave the unvaccinated behind as we move forward in this country. And this country will suffer not only medically, but economically if we leave the unvaccinated people behind. Because there have been people, businessmen in the past, during the height of the pandemic, I read it with great shock, saying, let's move forward with the vaccinated people. I mean, and I think in the newspapers as well. To me, that is short-sighted and silly, because you cannot. 50% unvaccinated. How are you going to make money, businessman?
You can't really move forward too fast.
We can't move forward too fast.
Yeah.
But we have to move forward.
No, what I mean.
Yeah.
In a statement like that, you're not going to move too fast.
What do you mean?
Because half of the people can't perform.
Exactly.
Right.
Yeah.
So you're going halfway.
Yeah.
But if you open up now fully for all vaccines, you see, as I say, there's an evolution.
Correct.
From now to then and then.
Yes. The vaccine changed. The situation changed.
Everything changed. And you changed. Now I think is the time to open.
I agree. And now is the time to let the safe zone should probably. What's the value of the safe zone really?
The safe zone is secured by the borders.
That is, of the restaurant, you mean?
No, the borders of the country.
Right.
The whole country is a safe zone.
The whole country is a safe zone. Exactly. The safe zone restaurant idea is probably a little bit outdated. That's our opinion.
That's my opinion.
That's my opinion as well. They might have other doctors who might have a different opinion.
Of course.
And
as I said when they interviewed me for that Express article, I said my view might be a little radical, you know.
I don't think that's radical at all.
No, but I just said.
Yeah, but there are other people who might think it's too. But if there's ever a time to move our people forward, it's now.
Now is the time. Now is the right time.
I believe so. I believe now is the time to come out and move our people forward. And we could always adjust as seen. Because the key part is in terms of science, if you're really following the science and not lagging behind the science. If you're following the science, we have reached a point where the virus has mutated to the mildest form, or a milder form.
Yeah, and the protocols, okay.
And it's not going to necessarily mutate to a more dangerous form. That hasn't really happened in 125 years. So, but it could still happen.
Yeah.
That's why we need people vaccinated. Sorry, go on.
No, but at the same time, I know it's probably not on your slides.
Yeah, go on.
But there needs to be a change in the hospital system.
What do you mean by that?
Because of the parallel healthcare system, the hospital system would have suffered, the normal system.
Oh, yeah.
Right?
Oh, yeah.
So you need now to revitalize that system.
That's more important to the health of the population at this point in time.
You need to revitalize that system.
That's an excellent point.
Because you have less people in the parallel system.
Now it's time to focus on the patients.
Less sick patients in the parallel system. So you need to develop the other system now.
Yeah, to look after people with diabetes.
Look after normal people who suffered because of the pandemic.
Excellent point. Excellent point. Excellent point. Do you think that people who enter in Trinidad, for example, you say you traveled recently to the United States, right? And I think in the US all you need is an antigen test to enter the country.
To go in, yes.
To go in. But yet in Trinidad, for us to come back home, we need a PCR test. Do you think they should move away from the PCR testing to enter the country, or is it still necessary to hold that really rigid? Because you're saying let's open up a little bit. I'm just thinking about opening up a little bit more.
I think if you're vaccinated, you should come in without a test.
Without a test?
Yes.
Even if the person is positive, though? If the person have COVID?
No. If you don't have symptoms,
come in.
And you're vaccinated, you should be able to come in.
All right. All right.
If you're vaccinated and you don't have symptoms, no.
Is any country in the world doing that at the moment that you know of?
I'm not sure.
Right.
But who could decide who have symptoms
or not?
Right.
Yeah.
Who could decide who have symptoms? That's where the problem will be.
That's why antigen test might come in handy.
Antigen test might come in handy. It's an easier test to do.
Yeah.
How reliable? Both the tests not 100% reliable.
Yeah, but it's still fairly. It's a good use. A good use. Josh, you could put up another slide there, please. COVID-19 news. 5 to 11 year olds in England to get vaccine from April. Now, why I put that up for there, Doc, is that what happened is in England, the kids are back out to school. The 5 to 11 year old. They're back out in school. They're doing their education, back out in physical school. However, what they're saying there in that article is that the kids, England was a little bit slower than the rest of Europe to give the kids the vaccine, right? The under 12s the vaccine. And England is saying that, hey, look, in April, we're going to give the kids the vaccine, although they're out in school and although they have it available. And the reason that one of the reasons why they put in that article that they're going to give the kids the vaccine in April is because they actually don't want kids to lose time off of school, believe it or not, to get the vaccine and or get the symptom of feeling sick after the vaccine. So So
April is what, the holiday?
Holiday time. So they actually say, look, we have the vaccines, the kids in school, April we'll vaccinate them. I thought it was kind of odd myself, if I did interpret that article correct. What do you think? Do you think it is
I think
safe?
the kids need the vaccination.
Right.
As I said
that
before,
is debatable.
The kids need the vaccination.
Yeah.
Now,
Do you think we could open schools without vaccinating kids?
What's that?
Do you think we should allow our kids back in school now, even though they have not been vaccinated, the under 12s?
I feel they should be vaccinated.
Before they go back out to school?
My preference is that they be vaccinated
before going out to school?
Before they go back out.
Right.
Now, some going out already, right?
The bigger kids.
The bigger
and a vaccine is available to them as well.
Yeah, the 12 and over, they could be vaccinated.
Yeah.
The younger ones, I think it will be a good thing if they vaccinated
before they go to school. Yeah. Why is that?
Because you would have it spread in the school. The kids will get it and take it home. Mm-hmm. Right? Mm-hmm. Now, if your parents and grandparents and so on vaccinated, mm-hmm. and the children have a symptom or so, chances are that they wouldn't get ill either. Mm-hmm. Right? They would mm-hmm. probably get a little sniffler and whatever else, but mm-hmm. nothing too serious.
Correct.
So that's fine. But for the non-vaccinated children coming to school,
non-vaccinated children coming to the school,
and they're carrying it home to non-vaccinated parents,
yeah,
then a problem could arise there.
Right. So, Doc, I'm going to stop you there, right? And I'm going to tell you that that is why it is important that the parents get vaccinated. But I do not agree with you, and that kids need to be, in my opinion, that we should vaccinate the kids before they go to school. A vaccination is not only about protecting others, it's about protecting yourself, those people at risk. And the risk of kids getting sick or getting and dying from Omicron is extremely small. And it's a very mild virus for kids. Kids have managed the coronavirus extremely well compared to adults, right? So you cannot sacrifice the education or the movement of children who are not affected by COVID, really not affected by COVID, and really not affected by Omicron, in order to protect an older person who has made the choice not to vaccinate. Do you understand what I am saying to you?
I understand, but the non-vaccinated adult,
correct, who has chosen not to be vaccinated.
Who has chosen not to be vaccinated.
You are saying to me to protect him because
he is going to ask his child not to be vaccinated too.
But then, regardless of what, the child not going to get vaccinated, Doc.
Right.
So then, why we're going to hold back forever?
Right. But the child going to carry it to him. The child mightn't get sick.
So what you are saying is that it should be mandatory vaccination for children? Because if you are saying to me,
I reached the point in my thinking right, that it shouldn't be mandatory.
It shouldn't be mandatory.
Right?
No.
But the preferred thing is that they be vaccinated.
All right. No, I'm going to hammer you a little bit narrow you down a little bit on this point. Eh? All right, Jazz, I'll take the break. So Jazz, tell me to take a break and drink some water. So, so guys, we're gonna take a little break and we'll be back in 1 minute. Thanks a lot.
ACTN The Voice launches a new and versatile culinary series called Stacy's Kitchen.
Hi everyone, welcome to Stacy's Kitchen. And on today's episode of Stacy's Kitchen, we will be cooking up a Thanksgiving feast. Our rolls are ready and looking yummy. Nothing like a good curry chicken and some basmati rice. So I'm gonna start putting my wings in to fry.
We will showcase how to make tasty international cuisine with our local products. We emphasize meals on a budget with our selected ingredients.
Restez à l'écoute, Stacy's Cuisine. Au revoir.
So you can put how much, depends on how big you want it. So our fish is ready. Oh my God, look at that. Oh my God, oh my God. Just like paratha, this is lovely.
Join us on ACTN on Monday evenings at 6:30 p.m. Don't miss Stacy's Kitchen, exclusively on ACTN The Voice.
Keep the popcorn popping, no, we're not stopping. Relax. So you know we in session. Time for talk through, I don't miss a load. Relax. So you know we in session. Don't you deal it, catch me by your TV. Every Thursday, ACTN The Voice in session. Yo, my name is Elisha. And my name is J Prince. This Thursday and every Thursday at 8 p.m. we are in session.
All right, guys, welcome back. We're here with Dr. Aroon Narayansingh, and we're discussing COVID-19 pandemic and the way forward. Dr. Narayansingh has put forward the narrative that it's time to open up, nice and slow, but we have to move forward. And yeah, Doc, just before we went to the break, you were saying that you think that we should vaccinate the kids before they go back out to school.
Okay, let me.
And I was of the opposite opinion.
We should
I think
offer them vaccine.
Offer them vaccine before they go back out to school.
Yes.
All right.
Just like the adults, we offer the adults vaccine.
Yes.
So we offer the kids vaccine.
I would have agreed with you, maybe in December during the Delta variant, but I think with the Omicron variant and the data on kids and what I hear coming back, and the way that the clinical symptoms in kids is very mild, I would have, and the emergent threat to the mental and social health of children at the moment. I believe in this country we never locked down schools for H1N1. We never locked down for influenza before. I think at this point in time, given the urgent need for kids to get back out to school, to protect themselves, we had other guests here who talk about the mental health effect on kids. I think that we're starting to weigh up now the non-COVID illnesses and the non-COVID stresses. And I think, in my opinion, now in 2022, February 2022, I think the risk from the non-COVID illnesses and non-COVID stresses is outweighing the actual risk from the Omicron for kids. And that is why I make my decision. That's why I made my opinion that we need to send them out now. You disagree, and we could disagree, that's fine.
No. They should be going to, just as I say, everybody should be going out.
Yeah.
Kids should be going to school.
Yeah.
Parents should
but
be going to
you're saying let's offer them the vaccine first.
They should be offered the vaccine.
Okay. And I think it should be coming in soon anyway. I think they said by March, late March, we'll be opening back up schools or something like that for under 12s. So it should be around.
And they have the vaccines too.
Yeah.
You know, that they could give it, but
they have the vaccine. I mean, if the pediatric formulation is available worldwide, it's just to get it here in Trinidad and Tobago. Josh, I think you have a slide there that you wanted to put up. I mean, yeah. So, Giles. Sorry, Giles. After this, we'll take the comment from the viewer. Okay. So, Doc, bring back this is something that you might have been mentioning just now. Bring back the old time, Giles. Bring back the old time days. Hug your granny again. Get vaccinated. This was an advert that was put out this week on social media from the ministry website. Yeah. I found it a little bit strange, right? And what I found strange about that, I think, and as I'm pointing out to you, it reinforces why I found it strange. The emphasis on this advertisement is the young guy getting vaccinated.
Yes.
But in reality, and I keep saying this over and over, the reality is the emphasis on the granny getting vaccinated.
Yes.
Would you agree with me or disagree with me?
Well,
and I think they've had the message back to front.
Right. That's right. This is a confusing message. Right?
This is a confusing message.
And I think they're really aiming to get
young people vaccinated.
The granny vaccinated.
But the message looked at me, go back to the old time ways, hug your granny again, get vaccinated. Your granny, you get vaccinated. So I think the emphasis that they put on the advert, which is why I found it confusing, was on the kid more than granny.
But they're not giving the kid.
But it's a boy, it's a man. He is entitled to a vaccine, it's available.
No, but they're not giving the kid the vaccine.
The
kids don't.
You mean younger kids?
Yes.
Yeah, exactly. Could unvaccinated kids go out and hug their granny? Could my children who are all under 12 go and hug granny and grandpa? Is it safe for them to do that, in your opinion?
Granny and grandpa vaccinated?
Granny and grandpa may or may not be vaccinated.
That's where the problem is.
All right. So you think that they could hug up granny if she's vaccinated, but not hug up grandpa if you're not vaccinated?
Yes.
All right. I disagree as well.
Okay.
Yeah. I think in Omicron.
Yeah, no, but granny will get sick, or whoever, which is the one that's not vaccinated, will get ill. And if they have comorbidities, they're in problems.
Okay. But
granny, you're talking about granny. Granny is 60 years.
You're assuming that the mortality from Omicron is 0.03%. You're basically assuming that it's a severe illness to put down granny or grandpa.
So what killing the people in Trinidad now?
It was the Delta variant.
No, but people dying still. Delta
variant would have killed the people, I believe.
No, that is on that time. No.
There's much less deaths.
No. Much less, but people still dying.
And I'll tell you what the community says, straight back to me. The community says that these are older people with chronic illnesses, severe chronic illnesses, who may or may not die if any flu affects them. And the other part of it is, how do you consider or classify a COVID death? A COVID death might be somebody who died from the complication of diabetes and is COVID positive. So you have all those factors coming in with 9 people dying. So I put it to you that the deaths are not necessarily people who are dying from a severe form of COVID.
From COVID.
No, I think it's now more than ever you'll see people with comorbidities, elderly people dying, right? More than the younger people dying from COVID.
Well, if that is the case, then the whole dynamics of the thing changed. But they haven't recorded as a COVID death.
Well, that is the part of it. That was always.
It was the COVID virus that killing them.
Well, how you classify a COVID death is you classify a COVID death either, I think it was in the newspaper recently, that somebody is diagnosed with COVID and die, or COVID might be a contributing cause of the death. So that COVID is a new virus. So this was a whole debate from the start of the pandemic. How do you classify a death that is a COVID death? How do you classify a COVID death? Now, the COVID death classification was really broad. It was people that died. I might be wrong. If one of my colleagues out there could correct me, fine. When the person was diagnosed with COVID, had COVID, and it considered it part of the illness that led to the demise, they were considered it a COVID positive death. I mean, even the public out there, if anyone wants to correct me on my interpretation of how a COVID death is classified, you can feel free and do so.
Well, the ministry have the way that they classify it, and they count it as a COVID death.
Exactly.
But right, as you mentioned, it could be some other thing
so
that they die from, but they are COVID positive.
In this life, we'll always have people, and Granny will always be at risk of severe illness, of catching a flu, of catching something and going down. How do you treat those people then? Because we can't keep Granny and Grandpa in a shell. And Granny and Grandpa have their right to determine whether they're going to get a vaccine or not as well. Can Granny and Grandpa come out and socialize with us?
Right. So, you see, this is where the thing is. If you're vaccinated, if Granny and Grandpa are vaccinated, it's a little safer for them.
Of course, and that's why we push in vaccines.
Right? Yeah. So you have to push the vaccine.
Of course.
But you can't leave the child out.
Of the vaccination.
You can't leave the communication between Granny and the child. That is an important communication.
What do you mean? In terms of development of the child and family dynamics?
Yes,
in terms
and the hugging and the
of course.
You know, that is an important part of development, and it's an important part of Granny too, you know.
All right, so I put it to you, Doc, right, that I think our grannies and grandpas should be allowed to hug their grandchildren at this point in time. I would ask Grandpa and Grandma to get vaccinated. Exactly. And I think Granny and Grandpa should be allowed. I mean, 2 years later, I really don't think it had much grannies and grandpas that didn't hug their grandchildren, who could stay away from them for 2 years. But Giles, do you have a question or a comment from a viewer? You could put it up first. Yeah. Blessed, good evening. First time I'm seeing this program. Congratulations on your public health awareness vision. You're very welcome. Thank you. It's my humble opinion that a vaccinated empty bag cannot stand up to COVID-19. For the last year, I've been saying we need to put emphasis on diet, continue on there, and chronic diseases. I'm saying this to CAFA and other stakeholders. Only within the last 2 weeks, I'm finally seeing the narrative being included. Why it take us so long to realize and include this? What's your comment on that, Doc? You understood that question, that comment?
No, I'm trying to understand it.
Right. What he's basically saying, I mean, forget the empty bag part. What he's basically saying is that the vaccine is very important, yes, but we have to focus on our health in terms of diet and chronic diseases. And that what he is saying is that if you're vaccinated a person who is sickly and has poor health, you can't go out there and think, well, I vaccinated, I'll be safe and I'll be fine. He's saying the effort and the emphasis must be put on the chronic diseases. I think that's what our view is getting
at. The virus, right? Mm-hmm. If you look at the people who are suffering from severe disease with the virus, are the comorbid ones.
Exactly. So he's correct.
They are the ill ones.
Yeah.
And if the country is a healthy country, then the virus wouldn't be so effective.
Correct. It wouldn't have been so lethal.
Yes.
Exactly. So the viewer, you're quite correct. Yes, you need to look after the comorbidities, and we need to have pushed that narrative from the start. And we need to have pushed, hindsight is great, but we need to have pushed the control of the chronic diseases, and maybe, even try and encourage people to diet and exercise and so on during the early parts of the pandemic. And you're right.
You know, right. Things like these, right?
Yeah.
This is what makes evolution in the way that we operate.
As doctors, you mean?
Yes.
Explain yourself.
We see now the importance of controlling these diseases.
Yeah.
And this is something that has making us more alert and more awake.
Yeah.
To what these diseases can do to us.
So you agree with the viewer?
Yes.
Yeah.
So it's a chronic disease with an acute hit.
Correct. That's what he meant by empty bag standing up with vaccine. He put it in his words, but that's what he meant.
Yeah.
He meant that you're physically weak. You could put up the next question there. Hi, good night, doctors. According to reports around the world, 5 to 11 age group who are out of school months now have not shown to be spreading the virus as much. No have been many outbreaks. These are usually the adults, teachers who have been bringing it to our schools. Children need to go out to schools vaccinated or not. All right. Fair enough, that's a good point.
Yeah.
I would tend to agree with you. Maybe Dr. Narayansingh.
No, as I said,
less so.
Children should go out to school, as I mentioned that earlier on.
Yeah.
And teachers should go to teach as well.
We have a little bit of discrepancy in the science part of it, right? I am aware that I've been somehow along the line I've come to the understanding. I don't know if I might be wrongly understood that children are less likely to give the virus to adults than adults are to give it to children.
That is true because children don't have the symptoms.
Correct. So Granny and Grandpa could even feel more safer now. I'll lay up the odds again.
Children, and if they have symptoms, it could be for a day or a half day or 2 days.
Right.
Right? And it's gone.
Right.
Because that's the time that it's more likely to spread.
Okay.
When you have the symptoms.
Okay. So, Giles, you can put up the next slide there for us. UK, this is on the UK. People with COVID in England won't need to self-isolate. Now, this is a very relevant topic to us. You can remove it there, Giles. This is very relevant to us because, for example, in Trinidad, the dissemination of information is sometimes a little bit poor. Eh? And as it currently stands, I'm seeing patients being quarantined for 21 days and for 14 days who have tested positive for COVID. England has made a movement away from that. And in that article, right, because I know you wouldn't have read it, what they're saying in the United Kingdom is that a lot more the onus is on you and your responsibility as an individual towards greater society. Might that be applicable in Trinidad? I don't know. But your responsibility towards greater society in that if you are sick, you stay home. Just like how it would have been done before the pandemic in terms of a flu. You stay home, you keep away from us, and when you feel better, you come out. They have moved a little bit away from, or about to move away from testing negative twice on antigen before you come back out to work. So they are no longer necessarily requiring you to stay as a state-mandated 14 or 21 days. And they're saying, listen, the onus is on you as a person. Get better and get your tail back out to work.
I agree with that. Mm-hmm. I agree with that.
Mm-hmm.
I attended a meeting today, and in that meeting, we decided that 7 days mm-hmm. after you stop having symptoms, mm-hmm. you go back to work. Mm-hmm. No PCR test necessary, no antigen test necessary.
Mm-hmm. But as it currently stands in Trinidad, most people, when they go into the hospital testing positive with COVID, is given 21 days.
Yeah, that's a little ridiculous now.
Exactly.
Especially for vaccinated people.
Right. So how would you recommend that we move forward with that? How do you do it in your hospital?
Just as I say.
Tell our viewers how do you do it in your hospital.
Okay, how we do it now,
yeah.
starting from tomorrow,
yes,
is you have symptoms,
yeah.
you tested,
yeah.
you're positive, right?
Yes.
So we go from there to when you stop having symptoms.
Yeah.
When you stop having symptoms, 7 days after that, you go back out to work.
Okay.
We don't need a test.
All right, so you stop having symptoms, you take 7 days, and then you go back out to work.
Yes.
All right, so you're 7 days clear. 7 days clear of any symptoms.
Right. But these are all vaccinated people. I have nobody working that's not vaccinated.
Right. Okay. And the vaccinated people could probably do a PCR, but you have nobody in your clinic, and that's how you do it there. All right. I would tend to agree. I think 14 and 21 days might be a little bit too much with the Omicron. And I'm very cognizant of the fact as well that we need to get the country going forward and the risk of spread of somebody who might be sick. So I think once somebody is 5 to 7 days clear, the risk of spreading the disease, especially in a maxed environment, is low.
It's spread you're dealing with.
Yeah.
No symptoms for 7 days.
Go back out. Go back out. They're going to be safe.
Yeah.
They're going to be safe. And PCR testing is expensive.
And you're vaccinated, and your workers around you vaccinated.
And most people have on mask.
Yeah, they wear masks.
Go back out to work. Yeah. All right, Doc. So we've come to the end of the program. Our hour has flown by. It was an interesting program. We might not have agreed fully on everything, but that's fine. Doctors really do.
Yeah, we should not agree on everything.
We should not agree on everything. I hope the viewers enjoyed it. I think it was educational for them. I would have liked more participation, but I'm sure they took it in and they have their own opinion. And as one thing that we say in the medical profession in Trinidad, we could agree to disagree, but we're moving forward.
Sure.
We'll reach a compromise.
This is my first time doing this, and it was enjoyable.
Good, Doc. I'm glad you enjoyed it. So thanks again. So guys, we've come to the end. I'd just like to thank Dr. Aroon Narayansingh again. He's from Medical Associates Hospital in St. Joseph. He's the medical director, a man with a lot of experience, a man of few words, very direct, but he got his message across. So guys, thank you to all of you at home for tuning in. Thank you for those guys who sent in message. Thank you to Josh and Giles for helping me produce this show tonight. Take care, everyone. Have a pleasant evening. Good night. God bless. We'll see you again next week. Take care, everyone.
Be safe.
Be safe.